Good evening and Johar to all of you. My dear friends, on behalf of Foxy, I am welcome all of you in this podcast series. This series is definitely a brainchild of our dynamic and visionary president, Dr. Sunita Tandulwadkar, madam. And I'm really, and we are really so happy and glad that even in such a busy schedule of ma'am is always there to bless us and to boost us. So thank you so much, ma'am, for always being with us. And so as we all know, and ma'am doesn't need any introduction, ma'am is our dynamic president Foxy for 2025. Ma'am is the past president of IAG, past president of Pune Obesity Society, and president-elect of ISAR. And what is that ma'am is credited with? The first stem cell IVF baby in India and first stem cell IVF baby of world at the age of 45 years. So thank you so much, ma'am. And when ma'am took over as a president Foxy, ma'am started so many, the programs like Do TK Zindagi Ke, Gyan Pravah, Gyan Deepika, then Nirmal. I'm so happy, ma'am. Just we are launching that the Nirmal in the at Banaras at UP. Yeah, so thank you so much, ma'am. And this is wonderful. That is the podcast. Apart from that, we have a Sampurna Swami and know your blood group. Ma'am, hats off to your vision. Many times, because I know, ma'am, I am working in a rural place and patients are coming and they don't know about their blood group. Forget about, we don't know the blood group, how we are going to arrange it. So this is a thing what you create awareness, ma'am. So hats off to you and definitely thank you for this initiative. And again, today's our special guest, again, the Sanjay sir, the Air Command Sanjay sir, again, doesn't need an introduction. Sir is a very dynamic person. And I can say, sir is one of the first person who think of doing about the LGBTQ committee, which is, I am a committee member of sexual medicine committee, and I know how this topic is, so much people don't want to talk about it. And the sexual health or simply the health of LGBT community is absolutely, ma'am, people don't want to talk about it. So hats off you, sir, that you started this project, sir. So thank you so much. And ma'am, before I start, I really want your blessings. Over to you, Sunita, ma'am, for your
Thank you, Apurva. And you know what, Sanjay, remember one thing. I can perform only because I have a dynamic people along with me. A lone president can dream. The reality, the implementation happens because my 30 committee chairperson, they are my cabinet ministers. They are working and I make them work. We push beyond the boundaries because they are the leaders of tomorrow. Dr. Apurva may become the Foxy president one day. 10 years down the line, 12 years down the line. So it's very important to show them the vision, the leadership quality, so that they will start envisioning them how they can help the woman health, maternal health, everything. So as a Foxy president, we have a 46,000 gynecologists who are registered with the Foxy. There may be 5,000 more, but in our organization, we have a 46,000 gynecologists who are spread in 286 societies as of now. And what is most important is we do a lot of academic projects and social projects. In social projects, Know Your Number is my project. You can visit on Foxy website, sir, and see in various presidential activities you will find every woman in the country, the longevity has increased. But unfortunately, the ladies in their 6th and 7th decade are not healthy. They have either diabetes, blood pressure, joint problem, obesity, everything on this earth. Not necessarily the cancer, but non-cancerous also. They have so many problems. So we want them to live very healthy life. So if they remain in a habit of checking their blood pressure suddenly doesn't become 200 by 150. It starts rising. India knows yoga, pranayam, Surya Namaskar. With this, they can control the blood pressure and they will never land up in hypertension. They will do the diet change. They will restrict the salt. They will do daily exercises. So all these can be prevented if acted in time. So that is my know your number, the woman health. Similarly, we have for for the maternal health संपूर्ण स्वस्थ जन्म अभियान. थोड़ा मोदी इफेक्ट आया है हमारे इसमें. स्वस्थ जन्म अभियान is every lady cannot be just become pregnant when she decide. She has to ensure that it cannot be accident, I should say. Sexual accident. When I'm working with the sexual committee, they just say, oh, I don't know how it happened. No, because 9 months that lady is a carrier of that baby, the train of the baby, in which baby is growing and traveling and will come out on this earth 9 months down the line. They should know that that lady is healthy physically and mentally. Her hemoglobin is normal, her sugars are normal, thyroids are normal. So many other projects we are working. So we have one very important project called Arogya Yog Yatra. In Arogya Yog Yatra, we are trying to reach out to the community of doctors and to the community of the common people, saying, bring the spirituality into your practice, into your medicine, and you will see the miracles happening. So there are many projects, sir. Sometimes we'll meet, but today is your day to have a dialogue. And Apurva, such a beautiful topic, and I'm sure we'll make this video podcast so viral that we will have millions of views and they will be benefited. This society will look after with the respect. That is very important, achieving the respect from all people. And I'm sure this podcast will help this community. Looking forward to hear further from different link. Thank you, Apurva. Thank you for always coming out of the box idea.
Thank you. Thank you so much, ma'am, for always your blessing, for always your encouragement, and ma'am, your dedication. Ma'am, I'm really, ma'am, I think अगर 10% भी आपका अगर हम लोग को मिल जाए मैम, है ना, हम लोग का लाइफ सेट हो जाएगा मैम. सर मैम, so thank you so much, ma'am. Thank you, ma'am. Thank you.
Thank you, ma'am.
Yeah. So after this blessings from our dynamic president, from Sunita madam, so it's time to start a one-to-one conversation about everything of LGBT community. Though it's itself is a very vital and very broad topic. And for those, because probably I have started clinic and my clinic is a queer friendly clinic. I am seeing the patients of LGBT community without being the judgmental. And probably my clinic is one of the first in Jharkhand and Bihar. But when I started this, I had a lot of doubt in my mind, sir, that how I will going to do it. So today, even this is a eye-opener lecture, eye-opener podcast for me also. So thank you so much, sir. And we will start our discussion. So, sir, whenever we are talking about LGBT, now it's AI plus is there. Sir, what actually this stand for? People has a lot of, doubts that what it's included. So over to you, sir. Yes, sir.
Thank you, Apurva. And that's a very important note to start with, because there are so many letters and letters which convey a lot to the person who's standing under that. And the fact that there are so many letters also signifies that there are more than the binary. Human form is diverse. Diversity is the norm of nature and not the exception. So, just as when we look at human beings, we find that no two human beings are alike. And when we look at nature, again, each production of nature is unique in itself and also similar. So there is this dichotomy that foxes us. Yes, there is the form which may appear a male anatomy and a female anatomy, and there may be variations in that, and that is known as differences in sex development. And that comes to the first, most uh, less talked about letter of the LGBTQAI, the I part, the intersex, which is nothing but diversity of genital anatomy or the sexual developmental process. So that is the intersex. When we talk things, we talk about development. And as you very well know, that the child grows in the womb, and that is where Fogsi comes into play. And then it is nurtured. It is nurtured to come out as a human being. And when they will come out, they will, battle with this question as to who am I? Who am I internally? What is my perception of myself? And this is from the viewpoint of the individual, that developing form. And this internal perception of oneself is called gender. And it is more than the DNA, it is more than the anatomy, it is that complete effect which comes from how we are wired and how we perceive ourselves. This is gender. And when there is a conflict between what others are perceiving you to be and what you perceive yourself to be, then we land up with a situation which is called as gender incongruence. And when there is gender incongruence, it may be 0.001% or it may be 99.99%, all incongruence. And the beauty, Apurva, is this, that this incongruence is two-way. One is the incongruence which the individual is feeling themselves from what is being told to them. And what is being told to them comes from people who are looking at the physicality of the person, the anatomy. So whenever there is this conflict between what is assigned, boy or girl, and what is perceived inside, then this is gender incongruence. And that is put under this beautiful letter T, which is transgender. It comes from this interesting word from organic chemistry, where you have trans molecules and cis molecules. If they are aligned in the same direction, we say cis. And if it is aligned in the opposite direction, then it's called trans. But then, mark my words, I said, this is an umbrella, because the incongruence may be as less as 0.1% to as great as 99.9%. So under this spectrum of gender comes the umbrella term transgender, but it may also be agender. It may also be other forms of perception which may not fit into the masculinity or the femininity of human form. As this organism grows, as they develop and they pass through puberty, new kind of attractions come. Attractions which are very different from the ones that the human form has for family members. Attraction which is necessary for procreation, for progression of species. And this is clubbed under what we know as sexual orientation. Of who do I want to be with for sexual pleasure? And herein comes these terms of saying that, am I heterosexual? That means I am attracted to the opposite sexually oriented person. So I will be heterosexual. Or whether I am gay, that means I am attracted to the same orientation, the individual who are the same orientation. Now, gay has been traditionally claimed by the male of the species, but it is also there in the female assigned at birth, and there they claim they stand under the term lesbian. So L is for lesbian, G is for gay. And then there are others who may be attracted to both. So we have bisexuals. Or they may be attracted to everybody and they are pansexual. Or they may not be attracted to anybody for associating with them for sexual pleasure, and then we will put them as asexual. So we have this beautiful rainbow of the community which stands under the LGB, which is sexual orientation, the T, which is gender gender affirmation, right? And then we have I, which is the intersex, right? So now comes to our question as to what are these pluses? Well, see, if you read my name, it says Air Commodore Dr. Sanjay Sharma retired, right? It gives you so many things. And then I am also a physician. I'm also an Indian. I'm also Himachal. So now comes this issue of having different cultural identities. And then there are these cultural identities which are identified as sexual minorities by people because they do not conform to the norms of society. We know the biggest names in our country, the Hijras, the Kinnars, the Joktas, if you go to the east, they are called Nipubanis, right? So there's so many names. They are cultural identities. They are a mix of human forms who may be diverse, not only in the human form, but they may also be diverse in their orientation or in their perception of gender. So we have put a plus for the cultural identities. And then why the second plus? Because science is evolving, because society is evolving. And there will be very many identities which we have missed. So that second plus is for them. I hope I've answered your question as to what
Absolutely,
is the LGBTQAI plus.
Actually, sir, you answered many questions. And it's really very clear because many times we have gender identity, gender orientation, or we have a gender diaspora. These all are really a confusion because there is a very small differences. So actually, you only explained the things where it's come from. So I think, sir, it's absolutely very important to know all these terminologies so that we can treat with them. Sir, when I go through your life history, sir, you are from such a prestigious, decorated from a decorated hospital, from a military background, AFC, AFMC. Then you have a pediatric training at RRR Hospital, again a topmost hospital of the, military is always be in our mind. It's so much discipline. Okay, and you are also awarded with the that is, sir, commendation by the Chief of the Air Staff. So, sir, from this background to entirely a different, I think it's more than 180-degree turn out to in the LGBT, for the LGBT community. I know you are also instrumenting the rights, LGBT community, people's transgender people's rights in 2019 by Government of India. You are one of the person who contributed in that. So what inspired you, to from this to this? Because when I am here, even people are scared of talking about sexuality. And what bring you from such a decorated officer to absolutely a different topic, which people even not think about their weirdest thought. So what's inspired you, sir?
Well, my inspiration came from home. And I'll tell you a little bit about this, but I also want to bring home this very important point that the eyes see what the mind knows. And when we get into medical college, and I got into this prestigious medical college at the age of 18, I had very little life experience. And I was in the business of, providing care for people. Who were my role models? People who were like me with little life experience, a little higher in age and in stature, who were teaching me the binary bodies. And this is how I moved into medical practice. 4.5 years of MBBS and then internship. Then you go on to do your practice. And this entire time, you never see diverse people in your clinic. I did not see one. I saw diabetes. I saw all diseases. But who were the people with those diseases in my clinics? There were people who were okay with conforming to the binary. The people who were not comfortable would not come to me. And since they never came to me, my mind never knew about them. And I went through life like this for 30 long years. And like you, I specialized in a subject which deals with families. I also did a lot of public health work in the defense services. Met other doctors also. But while I was commanding a hospital in Hyderabad, I got a call from my daughter, my elder daughter. And she was very agitated. She said, "Look, you have seen me as a boy, but this is not who I am. I am trans. And will you accept me? Or do I need to go out on the streets? Will you throw me out of the family?" And it was at that time that I had to step off from my high horse and make this decision of standing with my child. That's the first time I started seeing the issues which so far I had turned a blind eye to. They were there. And when I turned around with my issues to my colleagues, they said, "Yes, we will treat it." And when I talked to my daughter, she showed me a new world. It was she who told me about this beautiful organization called WPATH, the World Professional Association for Transgender Health. And it was then that I learned. And yes, to learn, I had to unlearn first. I unlearned that human beings come in two forms. I went and educated myself. I went across to WPATH. I did the foundation course. I did the advanced courses. I did everything that was needed to educate myself. And when I realized that we have a community which is close to 8% of the population, but they do not appear in the hospitals. We have a population of 140 crores. Just imagine what 8% of that would be. And where are these people? We have such brilliant doctors all over, but none of them see these people because they don't know about them. And why don't they know about them? Because they are not taught about them. There are no role models for them. So it is for those few people who have taken the trouble of educating themselves, they start seeing these people. Apurva, the most important thing is that as a healer, as a physician, it is not enough for me to see them. I also need to be professional when I touch them, when I talk to them. And it cannot be enough to say, okay, fine, I see you. It has to be that I care for you. And for that, I need to be trained. I need to be specialized, just as a gynecologist needs to be specialized to look at, assigned females at birth. Similarly, a person who's going to be looking at this unseen segment of normal people. Mind you, they're not ill, because gender incongruence is not a disease. And this is not me who's saying so. This is the WHO which is announcing that in 2018, when they brought out the ICD-11, they announced that gender incongruence is not a disorder. And it took it out of the domain of psychiatrists and placed it in reproductive and sexual health issues. And they clarified that it still gets an ICD number because these are conditions which require care by medical professionals. And this care is expensive. And this care requires insurance. Insurers require ICD numbers, and hence it is moved there. They also went on to clarify one other fact, which said that sexual orientation is also no business for doctors to treat. It is not a treatable condition. And it further, the fallout of this was that conversion therapy, which was being practiced earlier, was declared to be unethical. And see, this is how one starts seeing. And for one to see, one needs to know. For one to know, one needs to be taught and trained.
Absolutely.
So this has been my journey.
It's a really wonderful, and it's really you are a source of inspiration, sir. I feel your kid is so lucky to have a father like you. And definitely, I also feel that you are also lucky to have a
Yes.
as a daughter like her. But it's really, and definitely, sir, it's an eye opener for everyone and every parents. I have one patient, sir. I'm talking about my experience. I have one patient, and the patient is coming with some, some sort of STD. Some male patient is coming, and when I take the history first time, the patient is coming, and because he thinks somewhere he got the information that my clinic and I am the non-judgmental. The main problem where the trans or LGBT community are coming, they are thinking the doctor is transgender. They are judgmental. So they will not get the correct, and they will treat as a second class or third class citizen. So that's why they are not coming to the doctors. But what I feel, and we doctors are the first point of contact. So probably we should not be judgmental towards them. So I have one patient, sir, and the patient is seeing his basically roots are from Bihar, and his education is from Goa. So he's somewhat, a good exposure and everything. And he dared to tell to his father that yes, my sexual orientation is different, and I am inclined toward the male. And after that, his father going to depression, and some after 1 month, his health is deteriorated, and after 1.5 months, his father died.
Oh my
So
God.
every family is blamed on him. So now he is living alone, and even his mother is there, and who is already blamed that it's due to you who ruin our family. So this is the story, and I think the LGBT community or transgender persons are suffering like anything. They are suffering on own, and there is nobody who can tell them what is actual truth. So, sir, I am really hats off to you, and probably through this podcast, who are listening to this podcast, they will definitely think of that we should not be, even the parents, the teachers, the doctors should not be judgmental towards this, to treat them and to advise them.
Well, you have brought out a very important thing. See, the onus of care lies on the care providers and not on the individual who's seeking it. The onus of ensuring that the care is right again rests on the care providers, and it is not on the individual. Now, see, let's just cycle back to your case that you have brought out in this podcast. This child has been hiding a narrative, and this is the narrative of his true self from his near and dear ones, the people who love him the most. And why is he doing that? Because it's normal child psychology to exhibit what is appreciated and to closet what is not. Sometimes the child does not even have the language, but the family, under the pressure of the society, is giving cues to the child that this is what we desire from you. And this conflict causes the individual to have bad mental health, because the base is mistrust. It is mistrust from the people who are supposed to be giving care, who are supposed to be believing the story that the child is putting across. You also mentioned teachers. And see, the next tier to whom we go, like if I don't know something, I'll go and ask somebody who I think is knowledgeable. So I'll probably go and ask my teacher, or I'll ask my family physician. And if both don't know, then I'm stumped. Then I feel that maybe the questions that I'm asking are wrong. Maybe I should not be doing this. This is something which is evil. And a normal variance, a normal part of diversity of nature becomes a sin, becomes something which the LGBTQAI person is not able to exhibit a dual life. And this is the complication which is happening. So when we look at LGBTQAI people who walk into our clinics, we should remember that care comes first. And the care is not limited to your clinic. It needs to go out into the family. You also need to understand that this is not one individual you're talking to. This is the entire family. There's a mother, there's a father, there are siblings. Then there's an extended family. And it may be different in different cultures. There is an overload of religion. There may be an overload of the economic conditions that one has. What we scientifically say, the intersectionality, which influences mental health, which influences how a person will progress in society, whether they will contribute or they will disrupt. And it is this understanding that is demanded from a person who sets out to put up a queer affirmative practice. And this is something which is not irrational. This is a base. This is mandatory for anybody who wants to look at people who are marginalized. Because people who are in the minority, when they are faced in the majority narrative, then it becomes tougher for them. You are well aware of the term minority stress. And minority stress, a simple thing of you taking the right name, you asking what are your pronouns, or how should I address you? These simple things would bring down the discomfort, would open out that individual to tell you about themselves without fear of judgment, because they see you, they see the language that you use. And if you also have, in your practice, this issue of saying that, look, I might make some mistakes because I have been brought up in a binary world, but I'm ready to unlearn. And let us find out, what is it that you seek from me? This is my training. This is what I can provide. This is what your journey will look like. This is called participative care, where I team up with the person who's asking for care. And we deliver care which is to the best of our capacity, which is standardized. Like if somebody walks in your clinic with a gynecological issue, let's say she has, you know, uh, anything. It may be a simple thing of saying that I want some contraceptive advice. Would it be okay for you to give her half the knowledge? Absolutely not, no. Can you say, okay, this is what I will do. I will not give you the other options because I am not comfortable with them. I'm not going to offer you a IUD because you are not married. Or I am not going to, talk about the sexual health because you are still in school. And anyways, you should be, studying and not worrying about this is time enough to do everything. This professionalism, this following of standards is so important for the care provider. And this is where, when we get into a practice where we are dealing with the minority community like the LGBTQAI, we need to know the individual. That means I need to know the entire umbrella.
Absolutely.
I need to know what are the practices. How do they perceive life? It is not about me. Because when I know, then I can provide. Then I can change the forms that I have. Then I can make provisions for the issues that they will come to me. And there is this change which is happening in obs and gynae practice, where now that people are more informed, you would have a masculine looking person walking into your gynae practice and asking for menstrual regulation. Are you geared up for that? Should you be geared up for that? And why are you not geared up for that? These three things need to be addressed. And I'm sure with the dynamic president that you have, I think this is really going to change the way that the obs and gynae practice is going to happen in our country. And our country has always been the leaders in change. Diversity was something which was the norm in our country. We were never worried about people who did not look the same. We have them in our scriptures. We put them on our temple walls. It is only this 300 odd years where we got, our culture got erased. We started, learning a new way of curing people. If you go back to our traditional way of giving care, and Dr. Sunita did mention that when she's saying that kick back the spirituality into your practice. What essentially she's saying is kick back that compassion into your practice, where you respect the human form that is common. You respect that person who is now putting trust in you to give care and not be judgmental. So, and what better place to start than the gynecologist? Because the human form, it right from the inception, you are the people who give care. If we are going to be talking about diversity during the antenatal care, we'll be preparing that parent for that eventuality when they may be faced with a child who's diverse. In fact, I'll share with you, we put up in Lancet a birth certificate, which and it has been published in the Lancet, where we have said that a small step like giving a birth certificate which says that sex assigned at birth from external examination is male, female, stroke ambiguous. Gender will be affirmed by the child later. Writing this one line on a birth certificate would start conversations where the parents would be asking you, why is this line written there? Do you mean to say sex and gender are two different things? And then you can start this beautiful conversation and tell them, yes.
Absolutely.
They are so different. And do we need to take care? Is my child going to be like that? No. Just look out of the window and see the flowers in the garden. Each one is unique. Your child is going to be unique. It is you who is going to be prepared that if that child brings a narrative to you which does not match the narrative that you are wanting, you would know who to talk to. You would come to Dr. Apurva's clinic, which is queer friendly, and remember that poster that was put in his clinic, which talked about gender incongruence, which talked about saying that gender is different from sexual orientation and is different from differences in sex development. And they will remember that nice gender-bred person that was drawn there, where you explained so beautifully that gender is in the mind, the attraction is in the heart, and the sex that we see between the legs is nothing but a difference in anatomy. This is how we need to prepare our people through this important speciality to reconnect with our diversity, to reconnect with that acceptance. And Apurva, it is such a simple thing that if the family is comfortable, then the child is automatically comfortable. If the child is comfortable, then there is less risk-taking behavior. There is less mental health issues. There are less experimentations, unmonitored experimentations. There is this chain of communication which is maintained. There are less STIs. And these are proven things. We have research to base this on. What is needed is affirmative care. Nobody is telling you to, do rocket science here. What we are saying is that wear that hat of compassion, respect that individual, and believe the narrative, and provide the best of your capabilities. Do participative care.
Absolutely, sir. So you explained it so beautifully and so wonderfully. Probably after listening this podcast, the way of people seeing this LGBT or transgender persons is really, it will be changed. So thank you so much, sir. Sir, two things, as I think you have covered this, but still, what I feel that STDs is much common in LGBTs. And the reason being, probably they are thinking that wearing a condom is just to prevent the pregnancy. So many a time they are thinking, yeah, there is no issue of pregnancy, so why should I use the barrier or anything? So, sir, is there any difference in treating these patients from a normal general population, sir?
So there are two parts of this, Apurva. One is right now. Right now, when we have just about scraped the surface, we are not following up children from as a team. You're not during the well baby clinic or during the antenatal clinic having these conversations which I talked about, right? We are now seeing only those people who have come to your clinic because of the STIs. And therein, the data says that the LGBTQAI as a group is a high risk group for STIs. Actually, it is interpretation, because this is the very small segment who have, appeared in your clinics. But if you were take it as a normal distribution, then STIs are as common in any human form that you see. Again, in the LGBTQAI component, and we were when we talk about STIs, unfortunately, HIV was one of the STIs which erased everything else. So we forgot about syphilis, we forgot about gonorrhea, we forgot about other sexually transmitted diseases, even hepatitis B, C, D, which are bigger killers. We were not talking about them because we were faced with this big STI called HIV, which would kill people and which was being purported as the disease of the gay. And there we started labeling it strangely as men having sex with men who were more prone for this. And there we made this distinction that probably the L component is less exposed to HIV, so they were denied care. Again, a twisted kind of science, a pseudoscience I would call, because STI is less of an infection and more of a behavior issue.
Behavior.
And if behavior is related to an activity which is so essential for propagation of the species, after all, the sexual act is an essential part for propagation of the species, then it is something which needs to be universally told. Washing hands, universal, right? Effect, universal. Wearing a condom, universal. Effects, universal. Talking about STIs, when we do that, it should not be overshadowed by HIV. It should cover all others too. And while, yes, we do need to talk about HIV, I don't say that don't talk about it. Talk about it, but then also talk about the more common ones. Yeah. And when we are talking to the LGBTQAI people, now we also need to understand that here is a person whose narrative was not believed. Here is a person who is prone to high-risk behavior. Here is a person who you now need to, at least when you have your forms, to be asking them about the sexual practices that they are doing. If the sexual practice involves unprotected sex, then STIs will become a very big red flag for you, right? And you must address that. Again, being heterosexual does not mean that you will not be exposed to infections that are picked up by the sexual act. And another thing is that even in two human forms, be it any form, from cis to non-cis is what term I'm going to use now to say that the entire umbrella which we put, that do they not also enjoy the sexual pleasure of oral sex or of other sexual practices that that are there? And why should they not? We have an entire manual called the Kam Sutra, which has been written on the pleasures of to put it crudely, the flesh. But
and that too by Sir Indians, that too by Indian, our Maharshi, at second century. Yes, sir, absolutely.
So see, because this is normal. Does this not happen in the animal kingdom? Does, you mean that that the only way to enjoy pleasure is just the missionary position heterosexual way? No, it is not. Just like you would not be satisfied with only one kind of flavor that you take for breakfast, lunch, and dinner. God has given us a body, the sensory organs for for this, and that is why we say sexual health.
Yes.
And see, when we say sexual health, we are saying pleasure, we are saying safety, we are also saying well-being, because this is something which is so essential for maintaining relationships. And a lot of these issues are also the underlying issues which lead to mental health issues. So, by addressing sexual health as a complete holistic way, I think that is what is needed to be done. So when we and as a care provider, should I be doing this only if I have an inkling that this person is from the community? So now let me talk to him. Or would it not be simpler to do this irrespective of whoever they are and say, hey Apurva, I have this form here and I ask this from everybody. And what information you're going to give me is going to help me help you. There's no pressure. If you find the questions to be not comfortable, answer them later, right? Or tell me, I will learn that, right? If you're not comfortable with me, naming out parts of your body which you are not comfortable with, then please tell me. Write it down over there so that I don't make mistakes. And this is important for our, giving you holistic care. Is it to be done when I have reported to you with a toothache or with a headache? Well, it may not be important right now, but
yes,
trust building in this
absolutely.
whole building, when we are able to pick up more and more about the individual who's coming to care, and which I said right in the beginning, know the individual who's come to the care. Was this not what our teachers told us when we went to clinics? I remember being ticked off so many times, thrown out of the clinics. You don't even know the person's name. You don't know what this person is doing, and you are talking about some weird disease which you have read in some journal. What about the human being who is there? And can we normalize the entire spectrum? I think this is something that we need to be talking about, that medical education needs to be given for all human forms.
And the sexuality education is so important. So important.
So important.
Absolutely.
And I'll pose a question to you. Where do you think, when should we be asking or teaching about sexuality and gender?
Sir, what UNESCO has told, it should be from between 7 to 9 class, it should be started. Absolutely.
That means if I am getting into the business of healthcare, then as an undergraduate, the first few days of my training as an undergraduate, I need to be told about this. It needs to be there in my physiology books. We need to be talking about this. Because, You cannot wash your hands away by saying that this is something which should be done in school. No, sir. It should be done again when you are entering into your healthcare facility. Just as maths, the basics are again reinforced by any person who gets into the first class in the IITs too. So if you are in the business of science, then these are the facts which become the basic foundation of how you look at human beings, and it has to be there in the curriculum.
Absolutely, sir. You explained it so beautifully, and definitely it's a need of ours, sir. Sir, actually in 2018, when Supreme Court has decriminalized the same-sex marriages in India, and in 2019, there is a Transgender Person Protection Act is implicated. 2020, the rule has met. But again, say last year, Supreme Court has not recognized the same-sex marriage in India. So there is always a confusion. What is the legal rights right now in India for the transgender person and for the LGBTs?
So let me just clear the air. The law in our country recognizes differences in sexual orientation, right? And does not criminalize them, right? So this is the law, right? It also says that gender is self-affirmed. There is no test to be done, no validation to be given by any doctor, right? Now comes the society. Now the Transgender Persons Protection of Rights Act has come out after debate in the parliament, right? Who sits in the parliament? Representatives who we sent there, representatives of society, right? So is society ready for this? Very much. Because they are the people who debated and put this there. The issue which has come up is sanctity of marriage, right? What the Supreme Court and the laws have already given is that they recognize that people with differences in sexual orientation may live as couples, but they are not ready to give it sanctity of marriage. This is a bone of contention. India has always been known to be a country where we have probably gone slow and stepwise. The first step has already been navigated. This issue of saying that what would society determine to be a marriage, right? That is something which now needs to be navigated. And herein, I, through your podcast, want to bring out this idea that society is majorly composed of people who are the most productive part of society. It is they who decide how the society should function, so that the younger and the older also get looked after. Unfortunately, we have very few dinosaurs who want to dictate as to how society will move. I think it is time now for us to put science in front and say that companionship is an essential part of well-being. And who better knows this than the obs and gynae people? Because once the mother is happy, or family is happy, then you have a happy child. Sure. When you have families who are ready to shirk away traditions of putting kajal in the newborn's eyes, or putting honey into as the first feed, when the families have taken that decision, well-being has been good. When we ask that this debate should now be taken up by the most productive of society, the 20 to 40-year-olds, who should now come across and say that marriage as an institution needs these norms now. 200 years back, or why 200 years back? When I was entering into this institution of marriage, arranged marriage was the norm. The families would sit down and say, okay, yes, this union is sanctioned. Today, when we are global citizens, today, when each one of us needs to be interdependent and independent, is it not time for us to redefine marriage? And this is not social science, this is medical science, because now, if the companionship has to happen, it requires a new definition. Unions, companionship does require societal sanction for it to produce well-being. Because once my union with my partner has a legal sanction, which already it has, but now we want the privileges that come with marriage. And that is the second part. And I'm very hopeful. I'm a diehard optimist. Today, we are much ahead of the West. They are going back. They have anti-abortion laws, right? Some politician has decided that there are only two human forms when there is so much of scientific evidence. He's done that. He's declared it. But does that mean that these people do not exist? They still exist. And India is the, I think, leader, where we are already, having a center of excellence in All India Institute of Medical Sciences. We are making slow and steady steps to change the curriculum. Yes, we will take a little more time, but then we are making the positive steps, and it is up to the younger people to step up. They need to step up and say that this is the new norm for society that we want. And that is it. The law is there. There is no confusion. Nobody should have this confusion that the law does not permit you to stay together. It does. In fact, it gives you extra protection. But it will not say you're married, because marriage has got connotations of religion. Hindu Marriage Act is separate. The Muslim Marriage Act is separate. There is something now being talked about is the Uniform Civil Code. All should be taken away from the clutches of politics and be put in the scientific domain of eco-social science for the betterment of society.
Absolutely, sir. Thank you so much. You bring out such an important thing, sir. Sir, I feel like this topic is so much hidden, unteached, untalked, undiscussed topic. I think few days conference is actually short enough to discuss all this thing. And so it's almost 1 hour. It's past 1 hour, and it's like we started and it just finished it off. So we are actually running short in time, sir. But before I just stop this podcast, sir, I want very shortly any very interesting case which you have and you want to discuss with us in a very short, sir. Any patients or any case or anything? Yes, sir.
So see, this is one thing that I learned in this practice, that each person is unique. If you have seen one gay person, then you have seen only one. If you have seen one trans person, that is the only one you have seen, because the next one is going to be different. There is also this issue that when we are into a scientific discussion, we start discussing about bodies, and we bring out this in an effort to get the scientific tenor. But when we are dealing with transgender health as a subject, the most important thing that we need to do is to build trust, right? And the best way of building trust is to maintain confidentiality, right? So you will, I hope, understand why I will not discuss any case with you.
Okay, okay,
Because
absolutely.
each one is
Absolutely.
unique, and each one requires just one thing from us, is to believe the narrative that is being presented to us and to deliver care as what we know best, what is based on current scientific evidence. This is what we need to do.
Thank you so much, sir. And today it's really a eye-opener podcast for all of us, including me, sir, who are practicing as a sexual medicine and also seeing the LGBTQ community. But we have a different view of seeing them. Just a downline message, what I want to give to all the viewers, please be non-judgmental. Because what happened now when we are actually being judgmental to them, so they are going to quacks and every Baba Java and third person. And they makes their life more miserable, more difficult. We doctors, absolutely, they are not a different. You know, they are just like our other patients, and they too need love, care, and tender. So thank you so much, sir, for
Thank you.
joining with us, and even in such a short notice, and in such a you are, I know you are traveling, and still you managed to join, sir. Thank you so much, sir. And in the future also, we will definitely catch you hold for such more interesting and out of the box discussion. Thank you so
Thank
much.
you so
And
much.
at the last, I would like to thanks to our very own, our Dynamics President, Dr. Sunita Tandulwadkar, Madam, for bringing out this wonderful, the Gyan Pravah podcast. And at the last, the technical team, they are always with us. Thank you so much, the technical team. Thank you so much.
Thank you.
Okay. Thank you so much, sir.